Let me turn the floor over now to Jonathan Furman, who is going to talk about fluoroquinolones, some of the risks, and some of the new information which has come out over the last year and a half since we've last heard him present. Thank you, Jonathan.
Most of you all know me personally, and those that don't probably saw the presentation that's about a year and a half ago. Essentially, I found out the hard way that fluoroquinolones are very bad for you. In my case, I picked up a lot of very unpleasant and long-lasting, if not permanent, neuropsychiatric issues combined with chronic fatigue and issues with my tendons. Fortunately, none of my tendons have ruptured, but they get sore, stiff, and achy all the time. Neuropathy is another issue that I suffer from. There's been some improvement over the years, but this seems to be more or less permanent. Much too late. The FDA issued warning label updates and all of this. Unfortunately, about 15 years after I first got poisoned, the situation is looking very gruesome in terms of probably been millions of people that have been injured or disabled or perhaps dead, and no one noticed. So that's kind of the background there. And again, I'd point anyone who's curious to point them in the direction of Kevin's excellent YouTube channel. What's happened since that talk are a few things. One is that new evidence has emerged that in addition to fluoroquinolone antibiotics being extremely toxic to tendons, they are also toxic to vascular tissue. It's looking like they've contributed to people's aortas, the artery next to your heart, rupturing, which is often, if not most of the time, a lethal event. Since that information's come out, the FDA has again updated the warning label. We also got, prior to that, the FDA has put more explicit language about mental health problems that can arise from quinolone toxicity. So that's happened. What hasn't happened is we still have no real assessment on the level of damage that has been done. There is no treatment protocol, and no one, to my knowledge, is really looking for people that are suffering from these symptoms and even offering to help them, which is very disappointing to me at this point in the game. The other interesting thing that's happened over the past year does not involve quinolone antibiotics, but does involve quinoline antimalarials, which are a different class of drugs, but I have been following the issues with the quinoline antimalarials very, very closely, because even though these are two different kinds of drugs, the symptoms, particularly the neuropsychiatric symptoms, are so similar, and the drugs have a similar history in terms of how they were developed and how they were used. To make a long story short, the National Academy of Sciences is currently conducting a review on the safety of mefloquine, which was used by the Department of Defense heavily over the past 20 years, particularly in Iraq and Afghanistan. And the reason why this is happening is that the Veterans Administration, or the VA, has identified a very large segment of patients that they've diagnosed with PTSD. However, their PTSD is a little bit different than the traditional symptoms because, well, first of all, it doesn't respond to treatment, and it also has neurological and neuropsychiatric issues that are more pronounced than typical PTSD. So this got kicked to the Science Academy, and they are reviewing all of this and going to issue some kind of report. There are limits to the scope of what they're looking at doing, and they're pretty clear on that, but they are going to issue some kind of report, and that's going to go to Congress. They've had a few public meetings over the past year, all of which I've attended to my knowledge. I think I've been to all of them. And a few things have happened that were interesting, but I want to focus on one, which is at the second meeting, they invited a speaker who gave a presentation that was about an hour long, and this presentation was extremely fascinating because this individual was a doctor who spent his career working for the Department of Defense doing drug development. And he talked about the history of the Department of Defense developing antimalarials, and in particular a drug that he worked on that there was a lot of excitement around until they got to animal testing, and they were testing this drug on dogs, and I believe he said they had about 15 dogs. The test went for 3 weeks. There were no signs of any issues or side effects with any of the dogs on the drug, and on the end of the 3rd week, every single dog dies. I feel bad about saying that in this meeting, but that's what happened. Unfortunately, even more unfortunately, it was not clear what had actually killed the dogs, what the mechanism of death was. It took multiple attempts to determine this, and it was on the 3rd pass where they had resorted to examining tissue samples under a microscope when they discovered that the limbic system of the brain in all of the dogs was populated by microscopic lesions. Essentially, you saw pervasive but randomized neuron death. It was brain damage that shut down the entire living systems of these animals. And why this is very important is that it gives us an insight into the mechanism of damage of quinoline antimalarials. Now, does the same thing happen in humans? Has anyone examined tissue samples in humans? Don't know. But it did give us kind of an eyewitness scientific account as to what has happened in the past that gives us some insight into why people that are suffering from quinoline toxicity have neuropsychiatric issues. That was very fascinating. Again, quinoline antimalarial is not the same thing exactly as quinolone antibiotics, but very similar history. So that the results of the report are due to come out, I believe, in March. So I'm anxiously awaiting what the result of that is.
The following comments and opinions are regarding a scientific presentation at the 2019 National Academy of Science meeting on quinoline antimalarials.
The question came up at the end of his talk. What was the actual mechanism of damage to the neurons, the central nervous system, and the limbic system? And he said, we weren't able to do more research at that point in time because it was already clear this drug had failed the animal trials. But it sure looked like the most likely explanation was mitochondrial damage. And when I heard that, I breathed a sigh of relief because that was kind of the conclusion that I reached at the talk that I gave to Health Watch USA. So I was very relieved that someone who would be qualified to really answer that question came up with the same conclusion. So I do believe that that's important. The other thing he said is that unfortunately the mechanism of action that makes these drugs effective as antimalarials is the same mechanism of action that causes the toxicity. It's intrinsic to the class of drugs. If they're effective as antimicrobials to destroy the malaria parasite, they're probably going to be neurotoxic.
And that's one of the concerns I have with the development of new antibiotics, is that you have a lower safety window, is that you may come up with a new antibiotic, which is essentially a poison to the bacteria, but the safety margin for people may be less. I think that the easy, safe antibiotics may have already been found, and we're in a real mess regarding bacterial resistance.
I believe we are in a real mess regarding bacterial resistance and also parasite resistance, but we're developing a sense of desperation when it comes to drug development with antibiotics. And this itself could be a problem because what I feel like I found out the hard way is that we have severe undisclosed toxicities with the current antibiotics. It may not just be quinolone antibiotics or quinoline antimalarials. This may cross over into other classes of drugs, particularly if they're targeting DNA replication in the sense that mitochondria function, because mitochondria are essentially very similar to bacterial or parasitic organisms. which is why when you develop drugs that kill bacteria, there's a good chance that they'll have mitochondrial toxicity. But I want to say something about that desperation. One of the things historically that seems to have happened here is that as the United States was preparing to enter World War II, it was known that the global supply of quinine, which was the gold standard for treating malaria, was under the control of Imperial Japan. And in order for the United States military to be able to function in the South Pacific, they would need to be able to control malaria, but they didn't have any quinine. So they needed some form of synthetic quinine. And because of the desperation of entering into a global armed conflict, apparently some side effects were overlooked back in the end of the 1930s. And this is a legacy that apparently is still with us today, that we have undisclosed side effects that are critical from classes of drugs that have been around for almost 100 years. It was a sense of desperation that led to the looking the other way on those side effects. So as antibiotic resistance rates rise, or antimicrobial resistance rates rise, and we get a sense of desperation for a different reason, what Kevin said is right on the money. Our risks are increasing. Antibiotics are unique in the sense that the more you use the product, the less useful it is, therefore the less valuable it is economically. So pharmaceutical companies have been very reluctant to invest in new antibiotics. And of course, I personally believe that a lot of the drugs in the market, or antibiotics in the market right now, are far more toxic than we've been led to believe. So the response from the United States government has been to try to encourage antibiotic development by accelerating the pathway through the FDA by which these drugs are approved, which makes material the risks that Kevin and I were kind of alluding to in general. This is the policy version of saying we're willing to accept this. So it'll be interesting to see what happens in the next 10, 20, 30 years if new drugs do come to market.
Looking at containing the organisms, surveillance, making sure it doesn't spread, rather than hopefully developing antibiotics. Granted, that's still a good avenue to pursue, but as pointed out by the recent New York Times article by Andrew Jacobs, companies are going bankrupt. They're becoming insolvent. And
Right.
These are antibiotics that were in the same drug class as other antibiotics. So their longevity or their usefulness may not be that long with these bacteria. And who knows what the toxicity will be. So it's not a for sure strategy that's going to work with this idea of let's develop more antibiotics. So that's something that we really need to do, but it's also shouldn't be the only thing we're doing. We really have to put resources into staff, into screening, and into containment and prevention of spread. That's going to be key to us confronting these epidemics.
I did want to mention about Kim. One of the things that happened to me in the acute phase of my reaction was I developed akathisia. And I know that in Kim's case, her husband also developed akathisia. So it might be worth doing a talk just on akathisia because it's underdiagnosed, underrecognized, and when it happens, there's, at least in my situation, there was no plan for treating it.